In a groundbreaking development for maternal care in Louisiana, the Women's Prenatal Mental Health Unit has just celebrated its first anniversary. This unique facility is the first of its kind in the state, dedicated to addressing the mental health need of women during pregnancy and the postpartum period. As awareness of perinatal mental health continues to grow, the PMHU has emerged as a beacon of support for new and expectant mothers facing mental health challenges. Joining us today to discuss the significance of this milestone and the impact that it has is Dr. Kelly Cannon and Cherie Johnson. Good morning, ladies. How are you ladies feeling today?
Great.
Good morning. Thank you for having us.
Of course, ladies. Thank you both for coming on. This question can be for Dr. Cannon to start off with. Can you share the inspiration behind what started this Women's Perinatal Mental Health Unit?
Sure. So I think this really was started off from the physicians here at Women's Hospital really recognizing this great need for their patients. They recognize that when you have a mom who's pregnant and who's needing inpatient psychiatric care, there's really no good places to send them because they're not able to either get the care that they need or they couldn't get placement. And so they really recognized that these patients were needing a place to be able to get the care for their psychiatric needs as well as their obstetrical needs. And so this really was the perfect hospital to be able to have this special kind of unit. So where we would have patients be able to have both the psychiatric care that they need, but also just all the medical needs met all together. And that's what's been so, unique and just so needed.
Nice. You love to hear that. Now, Ms. Johnson, how was the response from the community been across Louisiana since the PMHU has opened up its doors?
Well, we've received patients from 35 of our parishes across the state and 6 other states in our nation. So we are one of 5 units specifically focused on pregnant and postpartum women. And we're able, because we're located within Women's Hospital, we're able to provide, as Dr. Cannon mentioned, obstetrical care to these patients who are experiencing perinatal mood and anxiety disorders or, any mental health issues that require hospitalization. And we can still support their obstetrical care while they're receiving that mental health treatment.
Absolutely wonderful news to hear. Now, I got 2 more questions before I get out of your ladies' hair, but both of these questions are directed to the both of you. What are your goals for the PMHU in the upcoming years?
I think just to continue what we're doing as far as offering the amazing care that we're doing. It has really been such an honor and a privilege to be a part of this team and seeing these moms, heal and grow. And just continuing to spread the word that there is a place that mothers can come and get care, both our pregnant moms and our postpartum moms. We take patients up to 1 year postpartum, and our unit is able to offer such specialized care. We're able to, address all of the medical needs. We're able to help support our moms that are breastfeeding and lactation services. We're able to have special visitation with our moms and infants. So these are all just, such unique things that we really just want to let patients know that we're here and that we're just going to continue to help and those moms that are really needing the care.
I would like to say that we are changing the trajectory of families, being able to provide this care in times of need. I feel like women are the cornerstone of our community, and part of our goals for this unit is really arms around pregnant and postpartum women and destigmatize mental health needs and allow moms to feel safe and not judged for any type of mental health crisis that they may be able to have. That way they can better bond with their babies, have better pregnancy outcomes, and really change the life of their family forever. So we just really want to encircle our arms around our moms and their families.
Wonderfully put right there. And it also segues into my next question about family. Now, once again, this question is for both of you ladies. How can family members and friends support their loved ones who may be struggling with that perinatal mental health issue that you were just highlighting?
think just being the support and being there for patients, but also recognizing when patients are in need of care and reaching out to, get them the care they need when they need it. That is sometimes something that, patients are, maybe they don't recognize that they need the care, but the family members do. And so just being there and then reaching out for help and encouraging patients to reach out for help when they need it, I think is very important.
I think we do receive patients who, their significant other or their spouse or their mother or their sister are recognizing that they're experiencing some symptoms that may need additional support, and they are reaching out on behalf of their loved one and contacting us and saying I think, or contacting their physician and kind of describing some of the symptoms that they're having. I think that family members play a crucial role in healing and getting encouragement to seek additional resources and additional health care.
Wonderfully put. Dr. Cannon and Ms. Johnson, I want to thank both you ladies for taking some time out of your day and highlighting this important nature to the Ark-La-Mist region. Your time is greatly appreciated.